Disposable circumcision anastomat is applied to circumcision suture of male genital organs. It is mainly composed of main body cover, mover, flexible hand grip, nail cabin protective cap, gasket, microslicer, top body, suturing nail, stable seat, circular anvil, concave seat, screw, safety pin, and tail location adjusting knob, and the product is also with caliper. There are a total of 7 models: ZSR DCA 34, 30A, 26, 22, 18, 14, 10. Firstly, take conventional operative treatment for patient. Take measurement by caliper, about 2/3 place from glans penis to coronary sulcus, and then select appropriate specifications. Before opening aseptic packaging of product, please check the specification marked on instrument and make sure it is proper for use. Stretch prepuce anti-clockwise, adjust location adjusting knob at the end of prepuce, cutting anastomat, and then gently take out concave seat at front of prepuce, cutting anastomat. Lubricate concave seat with iodine and put concave seat into prepuce. Put concave seat into prepuce and cover penis head. Make the concave seat tilt and maintain the inclination parallel with that of coronary sulcus. Prepuce naturally fits the curved top of concave seat. Then make fixation by suturing line or rubber gasket. Gently remove the nail cabin protective cap. Slowly insert the screw of well-fixed concave seat into the center hole at the main body of anastomat. Slightly rotate product body in order to be loaded smoothly. Clockwise screw location adjusting knob to make the plane at the end of screw parallel with the plane at the back of location adjusting knob. After adjustment the knob in place, make sure if the place where the prepuce will be cut is right or not, and if the prepuce is loose or not. After everything is confirmed without any problem, remove safety pin. Slowly and horizontally hold flexible hand grip with appropriate force till the well-fixed position. Trigger anastomas for 10 seconds. Loose flexible hand grip and assist to reset it. Anti-clockwise and slowly unscrew location adjusting knob. And then slowly take anastomas and removed prepuce out. Do not operate forcibly or excessively rotate concave seat so as to avoid incision tear. After, remove the instrument. Check the wound. Disinfect the wound in case of hemorrhage or hematoma. Wrap up with dry gauze and apply a pressure bandage for about 3 minutes. And then, dress it with an elastic bandage for 3 to 5 hours. Please watch the operation video as following.